It's easy to think of doctors and administrators belonging to two separate groups that are often pitted against each other. It's important to realize that both groups hold resources that are crucial to maintaining an efficient healthcare system. So how do we create the synergy between doctors and administrators to achieve the ultimate healthcare goal, increase health outcomes for our patients? Today, we're sitting down with Dr. Shoeb Sitafalwalla, cardiologist who is also the founder and director of the South Asian Cardiovascular Center. By collaborating with administrators, doctors, and other healthcare staff, Dr. Sitafalwalla is able to work towards a future free of cardiovascular disease for the South Asian community. All right, on to the interview. Let's hear Dr. Sitafalwalla's take on this. Thank you so much for joining us and talk to us, Dr. Sitafalwalla.
Thank you for having me.
What does the ideal doctor-administrator relationship look like?
I think that ideal physician-administrator relationship is built on trust. It's a partnership. The administrator isn't your boss, but he's not your employee either. And the same goes on the flip side. The important thing to understand is that in a healthcare organization, as a physician, you play a vital role. And frankly, I think we would all argue that we play the most important role, because without diagnosis and treatment, you really don't have healthcare. But before that patient enters your space, before that patient sees you, he or she has to be checked in, has to be marketed to, has to be registered, and there are 1,000 different steps before and there are 1,000 different steps after that allow you to do the job that you do. And that administrator helps do that. And so starting with a position of respect, starting with the understanding that there is a much bigger picture at play is important. And then from an administrator perspective, having appreciation for what we face, because our patient visits, they're not just 15, 20-minute meetings. They can be intellectually, mentally, and emotionally draining. And in 15, 20 minutes, you have to see that patient, diagnose, treat, make a connection that's personal, sometimes wipe a few tears, and that can be much more intense than sometimes others realize. And so as long as we respect each other, as long as we trust each other and know that we're all trying to hit that same goal, then I think that is that ideal physician-administrator relationship.
Why does the doctor-administrator relationship matter so much?
Well, I think when you consider the fact that the number of physicians that are being employed by healthcare systems or hospitals has gone up something like 50% since 2012. It's inevitable that that physician is no longer operating on an island. And the reason for that is you're part of a larger network, you're part of a larger team. And as physicians, we're now being held to some say different, some say higher standard. Now we're being entrusted to not only treat the sick, but maintain health, to not only take care of individuals, but maintain the wellness of populations. And you can't do that alone. You have to do that as part of a team. And that's why that physician-administrative relationship is so important. You need that team to support you, to help create and understand those metrics, to measure those metrics, to improve qualifiers that really help us understand how good of a job we're doing.
Do you believe that a solid relationship could have a positive impact on patient outcomes?
You know, it's not just having a good patient outcome, but having a happy patient and, I hope, a happy physician. One thing that we're learning a lot about, both in the media and in the science, is that almost something like 1 in 2 physicians are suffering from some level of burnout because just too much is being asked. And so if you don't have that support, if you don't have that administrative relationship, if you don't see administrators as an asset, then you're setting yourself up to be that 1 in 2 that gets burnt out. It's important to voice those concerns. It's important to advocate for the frustrations or the difficulties we have, because we know what's happening at the ground level. But it's also important to come up with solutions and participate in that process. And again, create a partnership with your administrator, not simply a one-way communication avenue.
You yourself have a lot of experience navigating the doctor-administrator relationship when establishing the South Asian Cardiovascular Center. The South Asian patient community is often overlooked. What did you learn in the journey of establishing this center?
I think the first and the biggest challenge is we simply don't have the data. Healthcare systems traditionally have never collected ethnicity-based data. Often South Asians are accounted for in a broader Asian population, which is a very wide spectrum of risk. And so our first challenge was working with registration teams to start accounting for ethnicity. Well, that raises the question of how do you ask it? And so that required us to work with more than 12 hospitals across the Advocate Healthcare Network to start understanding the technical needs of changing those systems. And then once that happened, we had to start training thousands of registration employees. And so that's been a multi-year process. It's a lot of administrative navigation, understanding needs, making sure they understand priorities from a clinical level, and we as clinicians understanding what are priorities from an administration level. It's a challenge. You have to really stretch your intellectual capacity, your creativity, and your time, for that matter. Suddenly, treating an MI becomes a lot easier, and sometimes then understanding, what the right color scheme is for a public health outreach campaign. It really allowed me to appreciate all the different components of that support network within a healthcare system. Working with marketing, working with IT, working with the digital folks. It was humbling.
Yeah.